These are the top 7 over-the-counter topical creams that you can get. They're all natural, and you can use them right now for your peripheral neuropathy. We're starting now. Peripheral neuropathy is so common. It's nerve pain, numbness, burning, tingling, aching, down to your feet, your toes, your fingers.
Peripheral neuropathy leads to chronic pain in your hands, in your feet, in your leg, lack of sensation, weakness, poor balance, difficulty walking. Do you get a lot of pain when you wake up in the morning, when you're walking on stairs? That could be neuropathy. So take a look at the blood vessels in the top left. They start to disappear. Then the nerves get shriveled. They get weak. So there's 2 components to this. The nerves themselves get weaker. They're less coated. The signal can't travel as well, but you also have poor blood flow. So when patients come to see us in clinic, we evaluate their blood flow and their nerve sensation. We can do this on the first appointment in the office, and there is easy procedures. In most of my patients, we can get the nerve pain at least 75% better and more functional, even in bad cases. And same thing with blood flow. We can get it better.
While peripheral neuropathy by itself won't kill you, it can significantly destroy the quality of your life, and rapidly it is associated with worsening of your health. It can lead to complications that can be life-threatening. There are key points including statistics, studies, and information about end-stage neuropathy that you should know.
When you first develop peripheral neuropathy, you start with some weakness, some numbness, some pain, and then as a couple years go by, that pain and numbness increase, especially at night in your hands, your feet, your legs. Then you develop constant pain, constant weakness. You might consider medication. It affects your sleep, but then it starts to get better, but then you're just weaker. You can barely move. You don't want to get up off the couch, and it seems better, but it's not.
So the most common symptoms for this are essentially numbness, burning, tingling, sensitivity to touch. Most people need creams, especially at nighttime or on the couch. When their feet are just throbbing, you're like, man, I'm going crazy. I cannot fall asleep. Everything's aching, everything's burning. Now, there's a couple dangerous causes of peripheral neuropathy. So for example, you might have vascular disease, poor blood flow, uncontrolled diabetes, but there's so many other things like age, heart issues, congestive heart failure. There's just so many different causes. If you haven't been diagnosed, make sure you get diagnosed.
I used to do a lot more nerve graft surgeries, but a rep showed me this once. The diabetic peripheral neuropathy market over the next 10 years is projected to grow from almost $3 billion to $5.3 billion. So a lot of money is being spent on just surgical treatment of peripheral neuropathy. The rates are going up dramatically. I've seen a study in Nature recently where it says that about 40% of the population can expect to develop peripheral neuropathy throughout their lifetime. So this is very important to address.
If you are diagnosed and you know it's peripheral neuropathy and you're already working with doctors, these are great creams and great solutions. Now, before I even start this list, sometimes the stuff changes, and online, there's things that combine many of these. There's great deals and great discounts. I keep an updated list of my top and most favorite neuropathy medications and creams that can safely start being used at nighttime especially. But I'm going to go over my top 7 list from worst to best. These are things that work really well for my patients and me. Statistically priced, reviews, prices. I do all the heavy lifting for you. So let's start with number 7. And the good news is you don't need to just use creams. There are so many great options. I would say about 75% of patients that come into my clinic get tremendous relief. So I say 75% of people get about 75% more improvement to their nerve pain. Creams are a great option, but there's also shoes, orthotics, vitamins, lab testing that you can do at home, diagnosis of conditions, reversing those conditions. So peripheral neuropathy and chronic nerve pain, you can definitely get better. Check out all the recommended videos I have on that down below. Number 7, Gold Bond Pain and Itch Relief Cream. This is menthol and Pramoxine. These are pretty cheap. So a bottle costs like $8 to $10, although it might go up with inflation, depending on who gets president. Get out there on November and vote here in America. But users report moderate relief from itching and mild pain. It is less effective for severe neuropathic pain, and it provides quick relief from itching and minor pains. It's definitely worth trying. I would say if you have severe pain, it's probably not going to do the trick, but if it's numb, tingling, aching a little bit, get the Gold Bond cream. It works really well, but the active ingredient in there is menthol. So menthol, there's a lot of great menthol-based creams in there that have it. So for example, like BioFreeze is a really good one many patients use. So menthol is a great one to consider.
I personally love trying menthol like BioFreeze. It's very well studied. It works on receptors to essentially get used to cool sensation, heat, and mechanical pain. So give it a try. It can make a huge difference for your nerve pain.
Number 6, capsaicin-based creams. The one I had listed here, I'm not going to tell you the specific name, but capsaicin is chili pepper extract. You can get these for like $10 to $20. It's a lotion with capsaicin, so that's the chili pepper extract. The way it works is it kind of burns for a couple minutes and your nerves say, hey, this is too much burning, let's just ignore it. And like in a minute, your sensation goes away. Some people love this. Some people it works great. Some people it does not work great. Some people it can work amazingly well. Some people it doesn't do anything at all. Depends kind of how bad and what type of nerve pain you have. Definitely worth trying. It's relatively safe. Just don't get it in private areas. Don't rub it in the wrong place. It can sometimes cause some burning to come where there should be no burning. Initially, it does cause a burning sensation, but consistent application, your body knows to ignore it.
Capsaicin is an old one, but a good one. It's low cost and can be very effective. Just be careful not to put it in the wrong spots.
Number 5, Aspercreme with Lidocaine. So Lidocaine is the same thing the dentist injects your cavity with to numb it up. So this can be really cheap. The thing with Lidocaine is you can put it on your toes, spray your fingers, your toes, there's sprays, there's creams, there's lotion. Lidocaine completely numbs it. That makes the nerves stop working. So the active ingredient is lidocaine, 4%. This can work extremely well, but the trick is you gotta fall asleep before it wears off. So that's really the trick. But I've had really positive reviews. This does provide almost complete numbing, but it is temporary. It does not get to the root cause of it. But it's very effective for pain relief. It's a non-greasy formula, but it is temporary and you gotta use a lot of it to keep applying it.
Lidocaine is an anesthetic. Essentially, it just shuts your nerves off. It doesn't last forever, but you get like an hour or two of good relief potentially, and that might be enough to fall asleep.
Number 4, Blue Emu Pain Relief Cream. So this is like 20 bucks for 4 ounces. It has emu oil, aloe vera. So aloe vera can be very good moisturizing. MSM. This is one of the top supplements for arthritis and anti-inflammatory pain, and glucosamine. That can work really well. So MSM, glucosamine, there are other natural ingredients. So while Blue Emu Pain Relief Cream is a good option and it's highly reviewed, you can take MSM, glucosamine in supplement form. In one study, MSM improved pain and functioning compared to placebo in people with arthritis. The dose typically ranges from about 1.5 to 6 grams per day. It's sometimes divided into 1, 2, or 3 doses. You can typically find these supplements in most stores. I've had so many patients comment in these videos about how much MSM has helped them. Same with my patients personally. It's made such a big difference.
Some studies are really good, but the statistics are very poor. There's only really about 1,000 patients in any reasonable studies, so it's not enough to make a strong recommendation. The dosage is 500 to 3,000 milligrams per day, and it can help with arthritis, anti-inflammation, improve joint mobility, and it's considered to be very safe. And I know some people have great results with it.
In fact, turmeric is phenomenal as well. There's studies that show turmeric can work just as well as anti-inflammatories like ibuprofen. I highly recommend turmeric for your nighttime nerve pain and throbbing. Turmeric is one of the most popular supplements for treating pain, including joint pain caused by osteoarthritis. Turmeric is so well studied. There's literally hundreds, if not thousands of studies, which all come to the same conclusion. Turmeric can be just as effective as an anti-inflammatory, has anti-inflammatory effect. It's relatively safe, although I go over the 10 potential side effects, especially as a blood thinner. It can help thin the blood, which for most people is a good thing. Some people, not a good thing. Dosages are about 500 milligrams 2 to 4 times per day. Many users like this cream. It soothes the skin, less irritation compared to other creams, but it can be more expensive. It just jam-packs a lot of those good treatments in there. The Salon Pain Relieving Patch. This is about 10 to 12 bucks for 20 patches. It has menthol and methyl salicylic acid in there. It's highly rated for convenience, effectiveness, and providing temporary relief. So patches can work really well. There's a lot of different stuff in there. There's lidocaine patches. There's like fentanyl patches that doctors can prescribe as well. Don't worry, it's the proper dosage. It's not from like the cartels where it's gonna kill you potentially. But these patches can provide temporary relief. The patches may not stick well on all skin types.
There are many different patches. You can have numbing lidocaine patches, you can have fentanyl patches, you can have other anti-inflammatories in there. And essentially over the course of an hour, 2 hours, it kind of leaks into your skin and gradually distributes it. Then you just get rid of the patch. Very convenient.
Number 2, Voltaren Arthritis Pain Gel. This is $20 to $25 for about 3.5 ounces. Voltaren is low cost, it works great. The active ingredient is diclofenac sodium. So this is a strong anti-inflammatory that's in a cream. It's highly rated, it's low cost, it's available at every convenience and grocery store. It's clinically proven to reduce pain, non-greasy, and it's marketed for arthritis, but you can use it off-label for neuropathy pain. This can work really well. In fact, what used to be popular in the healthcare world is compound creams, and almost all of them had diclofenac in it combined with other things. You could make a gel cream. Some of the more expensive ones have all these ingredients in the cream, and you apply the cream and it hits you with everything. Those can work really well, but they're outrageously expensive. But it's an option. A lot of these different creams, it's really the active ingredients, and these can work really well.
Compound creams actually worked really well. They would put like 10, 20 different ingredients. Many of them were things like diclofenac and other anti-inflammatories, and it worked extremely well. People got a lot of pain relief, but some of these tubes were like $5 grand. It was insane, and insurance was kind of in on the game with Big Pharma. You kind of know the drill by now. That kind of got shut down just because it's so outrageous.
But number 1, the highest rated one and the one with the most marketing push is the Penetrex Pain Relief Cream. So it's like 20 bucks or so. It has B vitamins in there. It has MSM, which is a supplement that I talk about in another video, Boswellia. Again, another supplement. I go into that in details in another video. And arnica, which kind of squeezes your blood vessels a little bit. So it's less itching, less irritation. This is an excellently reviewed cream, but it's really not just that cream. It's the active ingredients. These are strong, proven anti-inflammatory medications. Apply that to your skin. It's effective for many types of pain, including neuropathy. It's more expensive and requires regular application, but overall, what you want to do is you want to look into creams with menthol, like Biofreeze is really good. You want to look into creams with lidocaine. So lidocaine is probably the strongest, but needs frequent applications. You want to look into different supplements. So one you can take orally is turmeric, but also MSM, Boswellia, glucosamine. There's creams with arnica.
And while creams are good, vitamins can also be really beneficial. In some cases, they can even get rid of some people's neuropathy pain if there's a deficiency. So check out that video for sure, linked below.
There's Voltaren Arthritis Pain Gel that can work really well. Just the moisturizing as well can get rid of itching. Aspercreme with lidocaine, capsaicin creams are a phenomenal option. Try all of these out. There are combination ones and I link them down below. Each product has strengths and weaknesses, but really stick with what works for you. Some people love the menthol, some people love the lidocaine, some people love the combo creams. Test it all out. If these creams didn't work, creams are not the strongest option. Check out my full peripheral neuropathy guide, how to diagnose it, the symptoms, the best home natural remedies. I'm telling you, peripheral neuropathy has so many great treatments at home. You don't have to go pay a doctor like me if you don't have insurance or if you're in another part of the world. Hey, guess what? We have a phenomenal book. I believe this is the premier book on chronic nerve pain and peripheral neuropathy pain on the planet. I've put years of work seeing tens of thousands of peripheral neuropathy patients, working with some of the best diabetic endocrinologists, the best doctors, the best neurologists, in building out this book. For you, my viewers, we have a discount code available. Get on our mailing list and get that book down here.